Welcome back to Wellness Monday, your weekly dose. Today we're diving into a topic that many of us, especially those who enjoy staying active, might find surprisingly relevant. The common pain reliever ibuprofen and its potential impact on our bodies when we exercise in the heat. We often reach for ibuprofen to soothe those post-workout aches or to prevent discomfort during a long run. It's the over the counter hero, but what if that seemingly harmless pill could be creating hidden stress on vital organs, especially when combined with a hot environment? Today, we're going to explore some fascinating research that sheds light on this very question. We'll be breaking down a study titled Effect of Ibuprofen on Markers of Acute Kidney Injury, Intestinal Injury, and Endotoxemia after running in the heat. Sound complex, right? Don't worry, I'll simplify it for you. First, let's talk about what ibuprofen does. So, ibuprofen is a NSAID, and that's a non-steroidal anti-inflammatory drug. And essentially, ibuprofen turns down the volume on those inflammatory signals that you may get when you have a pain, fever, or even inflammation. This is great for short term pain relief, but as our research highlights, there are potential side effects, especially in specific scenarios like exercising in the heat. First, let's start with our kidneys. These amazing organs filter waste from our blood. The study explains that ibuprofen can cause blood vessels in your kidneys to constrict. Think of it as tightening a hose. Less blood flows through, and this reduced blood flow can increase the risk of something called acute kidney injury, or AKI. AKI is a sudden decline in your kidney's ability to do their job, leading to a buildup of waste products, and we don't want that. Now, here's where the heat comes in. When you're exercising in a hot environment, your body already redirects blood flow away from your kidneys towards your muscles and your skin to cool you down. This also causes blood vessels to constrict in your kidneys. So if you take ibuprofen before exercising in the heat, you're essentially hitting your kidneys with a double whammy. Both the drug and the heat are constricting those blood vessels, potentially exacerbating the strain on your kidneys. Next up, let's talk about your gut. Your gastrointestinal tract, or GI. Many of us are familiar with the common GI side effects of ibuprofen, like nausea or stomach pain, but the research points to something deeper. Ibuprofen can reduce blood flow to your intestines, and this can damage the lining of your gut and makes it more permeable or leaky. Imagine your intestinal lining as a protective fence. When it's damaged, gaps appear, allowing unwanted substances from your gut, like bacteria and toxins, to leak into your bloodstream. This is known as endotoxemia. And guess what? Exercising in the heat also increases gut permeability. So, again, we see a potential synergistic effect. Ibuprofen combined with heat can make your gut even leakier, potentially leading to increased endotoxemia and systemic inflammation. This inflammation can have far reaching consequences, impacting everything from your immune system to your risk of heat related illnesses. So you might ask, what did this specific study look into? So the study was done at the University of New Mexico, and they recruited 12 physically active adults, 6 males and 6 females between the ages of 18 and 45. They had participants run for 1 hour at a moderate intensity in a hot environment, 35 degrees Celsius or 95 degrees Fahrenheit. In one trial, participants took 600 milligrams of ibuprofen, which is the common dose, before exercising, and in another, they took a placebo. So, this is what it found. So, in your kidneys, while there wasn't any statistically significant differences in the kidney markers between ibuprofen and the placebo group, The trend was concerning. For specific AKI markers, 4 out of 11 participants in the placebo group showed an increased risk of AKI, while 6 out of 11 participants in the ibuprofen group surpassed this threshold. This suggests a tendency for ibuprofen to increase AKI risk. Now, when we look at intestinal damage, running in the heat, regardless of ibuprofen, increased markers of intestinal cell injury. Increasingly enough, 3 out of 11 participants in the placebo group showed a significant increase in intestinal damage, whereas only one participant in the ibuprofen group hit this mark. This finding, while seemingly counteractive, might be due to the specific markers used for the complexity of our body's response. It highlights that exercise in the heat itself poses a risk on gut integrity. When you look at inflammation, the study found that 1 hour of running in the heat significantly increased several circulatory inflammatory markers. And when you look at ibuprofen's inflammatory role, ibuprofen increased circulatory and decreased anti-inflammatory roles. And this just suggests that while ibuprofen aims to reduce some inflammation, it might alter the overall immune response in complex ways during heat exercise. And when you look at your core temperature, the good news is that ibuprofen didn't affect your body's core temperature or overall body weight loss during exercise, meaning that it didn't necessarily worsen in the heat, and that's a good thing. So you might ask, what does this mean for you? This research and other studies suggest that while ibuprofen can be helpful for acute pain, use it be careful when you use it. So if you use it before or during exercise in a hot environment, it may increase the risk of subtle but potentially impactful kidney and intestinal distress. Here are some key considerations for you. Hydration is paramount. Consider alternatives such as stretching, foam rolling, a massage, or even cold water therapy. Listen to your body. Consult with your healthcare professional, or even understand your why. Why are you taking ibuprofen? Is it for chronic issues? Could there be any underlying overuse injuries that could be addressed through proper training, modifications, or even physical therapy? The goal isn't to make ibuprofen seen as something that's bad for you, but to empower you with knowledge. Being aware of these potential interactions allows you to make more informed decisions about your health and how you fuel and recover from your workouts. That's it for this Wellness Monday. Stay hydrated, stay informed, but most importantly, stay well. We'll see you next week here at Wellness Monday, your weekly dose.